Hi, my name is Tezia Gonzales. I'm the director at Ability Rehabilitation of Winter Garden. We have been open since October 2021. I've been practicing PT for over 6 years. Pregnancy is a very exciting time. You have constant thoughts of the future and how much your life is going to change for the better. You probably have so many ideas of how to care and love for your baby both before and after birth. But what about you? Your body is a temple to that little baby for 9 months and you have to take care of it. This of course includes eating well, taking the proper vitamins, but also importantly, exercising and stretching. Exercise can be helpful to the mother for many reasons, including improving circulation for reduction in bloating, swelling and digestion issues, helps prevent depression. It can prevent pregnancy complications such as gestational diabetes and hypertension, increased relaxation for improved mood and energy levels, prevention of muscle tightness, back and ligament pain. It can prevent muscle and leg cramps, help you to sleep better, promote strength and endurance, and recent research even says that babies of moms who exercise have a stronger and healthier heart. However, you still need to be cautious. You want to ensure proper technique to avoid any injury. Don't overdo it. Avoid too much heat or humidity due to your poor temperature regulation from an increased blood flow and metabolic rate. Slow and controlled movements due to constantly changing of your center of gravity position, which may alter your normal sense of balance. Certain positions should also be avoided or held for short term during second or third trimester, such as stomach lying or prone positions should be avoided. Back lying or supine, limit to 1 to 2 minutes due to reduction in blood flow to the uterus. Avoid intense or extreme abdominal work due to weakening and separating abdominal muscles. Focus on stabilization versus deep twist rotations or progressive crunch positions. I will now review a few important stretches and exercises to help ease discomfort during pregnancy and to help promote an easy labor and delivery process. I will also discuss various modifications needed to increase or decrease intensity based on your specific trimester for the safest option. So the first stretch is called a deep yoga squat, and you can make it as easy or as hard as you want. The position is a wide stance. It's up to you how wide, and you want your feet to be flat, and you want to push your elbows into your legs to help give an extra stretch through the inner thigh. Ideally, you want to hold this for maybe a minute or two, but if it feels difficult, you can always start with about 30 seconds. Okay. This is a hamstring stretch. You can do it seated, is usually the easiest way, more apt to do it more frequently. You're going to do one leg at a time. You want your knee to be straight. If you want added sciatic nerve stretch, so if you're getting any sensations down your leg, you can add a little extra foot pull up and it'll give you an extra stretch. You want to make sure that your back stays flat, and then you can lean forward until you feel a gentle pull, light to medium, down your leg. The next exercise is diaphragmatic breathing. It's good for labor and delivery, relaxation of muscles, and just helps to regulate your breathing techniques. So one hand will go on your breastbone, the other hand will go on your abdomen. Everything should be coming from your abdomen, right around your belly button. Your chest should not rise and fall in this style of breathing. So your chest will stay still. And this can be performed seated, supine, on your back, or standing, depending on your trimester. The next exercise is a frog or a groin stretch to help stretch out your inner thighs. It can be performed in several different positions. You can do it seated, bringing your legs up towards you, kind of also called a butterfly stretch. You can push your legs down for added pressure, depending on how much stretch you want. You can also do it lying down. And just letting your legs fall out for as much stretch as you want. If it feels too strong, you can put pillows underneath your thighs. The next stretch is added lumbar flexion with some adductor and hamstring stretch. You want your legs to be positioned into a V shape as much as you feel comfortable. And once you feel comfortable, you can lean forward. You can walk your hands or you can slide out wherever your body will allow it to stretch, keeping in mind the abdomen. You don't want to put too much pressure, but you do want to feel a stretch through your inner thighs. The next stretch is a piriformis stretch, which is also important if you're having any sciatic issues running down your leg at all, which is very common. The most advanced version is lying on your back. Early on in the pregnancy, this is fine, but as you get later on, it might become more difficult. So the most challenging way is lying on your back and pulling this leg towards you. The stretch should be felt on the leg that it's crossed over top. You should feel it in the glute and the back area. If this feels too difficult, you can modify it, staying in this position and just pulling towards you. You want to think of pulling out and across towards your opposite shoulder. Again, it should be felt in your glute region of the leg that's on the top. The piriformis stretch is very important, so you can also do it seated. Anything that's going to help you be more apt to do it. So either lying down in the two positions or seated. In seated, bring your leg on top like you're crossing your leg. Posture is important first. You can either push down or pull into it, whatever feels most comfortable. Again, you should feel it in your hip region and along your glute area. The next exercise is called a bridge, which is important for core strengthening. You want to keep your glutes tight and tighten up your core. The next exercise is called a cat-cow. It's going to help stretch out your lower back and promote mobility of your hip and your spine. So you're going to slowly lower down. Hold for a few seconds. And then come up, alternating and holding at the same time. So we're going to start with a standard squat. You want your feet to be straight ahead, hip width apart. You can put your arms out in front to help with your balance and your center of gravity, and you're just going to come straight down. Act as if there's a chair behind you, and you can use a chair if you need it for balance and support. And you're just going to come straight down till you feel a strengthening in your thighs. And if you want an extra challenge, you can always add a little free weight. Either just to come up and down with you, or again, if you want more of a challenge, you can lift to get an arm workout. Another strength exercise you can do are lunges. Pretty basic. You can go forward and you can go to the side. Both have benefits for your hips and your thighs. The forward lunge, again, you want a nice distance in between the two, and you want to feel like you're coming down, straight down. You don't want to lean, you want to come straight down. And then you can do it sideways for more inner and outer thigh. The last exercise is a bird dog. I will show you the most advanced version first, and you can always alternate arms and legs in single frequency if you need to for an easier version. You want to make sure that your pelvis and your spine are neutral the entire time, not letting it wobble or move too much. Think of keeping your back nice and flat. You can hold the position, or you can move through the position. I'm going to hold it. If this feels too difficult, you can just use your arms or just use your legs.